Did you know that heart disease is the leading cause of death worldwide, killing more than 17 million people every year? That's more than all cancers combined. But what if I told you that many of these deaths could have been prevented if the signs of heart disease were detected and treated early? Yes, you heard me right. There are some specific early warning signs of heart disease that you should never ignore. In fact, they could save your life. In this video, we will reveal 12 early warning signs of heart disease that you should never ignore. Many of these signs will surprise you, so keep watching until the end to learn about all of them. And without further ado, let's get started. Number 1. Sweating. Sweating is a normal response to heat, exercise, or stress, but it can also be a sign of a heart attack or a heart failure. When your heart is struggling to pump blood, your body may try to cool itself down by triggering your sweat glands to produce more sweat. You may also feel cold, clammy, or anxious. So, if you sweat more than usual, especially if you're not doing anything strenuous, it could be a sign your heart is not okay. Number 2. Cough that won't quit. A cough is a common symptom of many respiratory infections, allergies, or asthma, but it can also be a sign of a heart problem. When your heart is weak or damaged, it can't pump blood efficiently, and fluid may build up in your lungs, causing you to cough. You may also cough up blood or pink, phony mucus. This is a sign of a heart failure, which is a condition where your heart can't meet the body's needs for blood and oxygen. A heart failure can be life-threatening, so if you have a persistent or worsening cough, and some of the other symptoms we will explain next, see a doctor as soon as possible. Number 3. Chest discomfort. Chest discomfort is one of the most common and well-known signs of a heart problem. Chest discomfort happens when your heart muscle doesn't get enough oxygen-rich blood, which can be due to plaque buildup in your arteries or a blood clot that blocks the blood flow. This makes your heart work harder and creates a feeling of pressure, squeezing, or pain in your chest. It usually lasts longer than a few minutes. It may happen when you're at rest or when you're doing something physical. Sometimes the pain may radiate to your arm, neck, jaw, shoulder, or back. So, if you have chest discomfort that comes and goes, or that only happens at certain times, it could be a sign of angina, which is a warning sign of a heart disease. Number 4. Leg pain. Leg pain is another symptom that can indicate a heart problem. It can happen when you have a condition called peripheral artery disease, which is when your arteries narrow and become clogged with plaque. This reduces the blood flow to your legs and causes pain, cramping, or numbness, especially when you walk or exercise. The pain may go away when you rest, but it can come back when you resume your activity. Peripheral artery disease can affect any artery in your body, but it's more common in the legs. And guess what? The same plaque that blocks your leg arteries can also block your heart arteries and increase your risk of having a heart attack or stroke. That's why leg pain is not something you should ignore. It could be a sign that your heart is in trouble and you need to take action. Number 5. Swelling in your legs. This is another symptom of a heart failure, and it happens when your heart can't pump blood effectively, which makes the blood flow to your legs slow down, and then fluid leaks from your blood vessels into your tissues. This causes your legs to swell up, and you may feel pain, heaviness, or tightness in your lower limbs. You may also notice that your shoes or socks feel tight, or that you have gained weight suddenly. This type of swelling is called edema, and it can also affect your feet, ankles, or abdomen. Edema can be caused by any type of heart disease that affects your heart's pumping ability, such as coronary artery disease, cardiomyopathy, or heart valve problems. Edema is not only uncomfortable, but also dangerous, because it can increase your risk of blood clots, infections, or skin ulcers. So, if you notice swelling in your legs, don't brush it off. It could be a sign that your heart is not okay, and you need to get it checked out. Number 6. Skin color changes. Your skin color can tell you a lot about your health, and some changes can be a sign of a heart problem. For example, if your skin looks pale or blue, especially in your fingers or toes, it could mean that your blood is not getting enough oxygen due to a heart defect, a heart failure, or a lung disease. This is called cyanosis, and it can be a serious condition that requires immediate medical attention. Another skin color change that can indicate a heart problem is a yellow-orange bumpy rash that appears on your elbows, knees, or buttocks. This is called eruptive xanthoma, and it is caused by high levels of triglycerides, a type of fat in your blood. High triglycerides can increase your risk of atherosclerosis and heart disease. So if you notice any unusual skin color changes, especially if you have other symptoms or risk factors for heart disease, see a doctor as soon as possible. Before we continue, if you have been enjoying the video so far, hit the like button and share it with your friends and family. You never know, you might save someone's life. Number 7. Left shoulder pain. You may not think that your shoulder has anything to do with your heart, but it could be a sign of a serious problem. Sometimes, when your heart is not getting enough blood and oxygen, it can send pain signals to other parts of your body, such as your left arm, neck, jaw, or shoulder. This is called referred pain, and it can happen during a heart attack or an angina attack. Angina is a condition where your heart muscle is not getting enough blood flow due to narrowed or blocked arteries. It can cause chest pain or discomfort that may radiate to your left shoulder. So if you feel a sudden or severe pain in your left shoulder, especially if it is accompanied by chest pain, shortness of breath, nausea, or sweating, don't ignore it. Call 911 or seek medical help immediately. It could be a matter of life or death. Number 8. Dizziness or lightheadedness. This can happen when your blood pressure drops suddenly or when your heart rhythm is abnormal. Both of these conditions can reduce the blood flow to your brain and make you feel faint or dizzy. You may also feel like your heart is pounding, racing, or skipping beats. These are called palpitations, and they can also be a sign of a serious heart problem, such as an arrhythmia, a heart valve disorder, or a heart failure. Number 9. Nausea, heartburn, or stomach pain. Some people may have these symptoms during a heart attack, especially women. They may even vomit or feel sick to their stomach. This happens because the nerves that supply the heart and the stomach are connected, and the pain signals from the heart may be misinterpreted by the brain as coming from the stomach. So if you have these symptoms and you're at risk for heart problems, don't assume it's just something you ate. Get it checked out by a doctor, especially if you also have any of the other signs on this list. Number 10. Fatigue. Fatigue is a feeling of tiredness or exhaustion that doesn't go away with rest or sleep. It can be caused by many factors, such as stress, depression, anemia, thyroid problems, or chronic diseases. But it can also be a sign of a heart problem, especially in women. When your heart is not working well, it can't deliver enough blood and oxygen to your body, and you may feel weak, sluggish, or worn out. You may also have trouble doing your daily activities, such as climbing stairs, carrying groceries, or walking short distances. If you feel fatigued and you have other symptoms or risk factors for heart disease, don't ignore it. See a doctor and get your heart checked. Number 11. Irregular heartbeat. Your heart normally beats in a regular rhythm, about 60 to 100 times per minute, but sometimes your heart may beat too fast, too slow, or irregularly. This is called an arrhythmia, and it can be caused by many factors, such as stress, caffeine, nicotine, alcohol, or certain medications. Some arrhythmias are harmless and may not cause any symptoms. But other arrhythmias can be dangerous and can lead to a stroke, a heart failure, or a sudden cardiac arrest. Some of the symptoms of an arrhythmia include palpitations, chest pain, shortness of breath, dizziness, fainting, or sweating. If you have any of these symptoms, or if you notice that your heart is beating abnormally, see a doctor as soon as possible. You may need an electrocardiogram or a Holter monitor to diagnose and treat your arrhythmia. Number 12. Snoring. You may think that snoring is just a nuisance for you and your partner, but it can also be a sign of a dangerous condition called sleep apnea. Sleep apnea is when your breathing stops and starts repeatedly during the night, causing you to snore loudly and gasp for air. This can disrupt your sleep quality and make you feel tired and groggy during the day. But more importantly, it can also increase your blood pressure and strain your heart, putting you in a higher risk of a heart attack or a stroke. So, if you snore a lot, or if you have been told that you stop breathing while you sleep, talk to your doctor about getting tested for sleep apnea. There are treatments available that can help you breathe better and protect your heart. These are some of the early warning signs of heart disease that you should never ignore. If you have any of them, don't hesitate to see your doctor and get checked for your heart health. Remember, heart disease is not inevitable. You can prevent it or treat it by making some lifestyle changes, such as quitting smoking, eating a healthy diet, exercising regularly, managing your stress, and taking your medications as prescribed. By doing so, you can lower your risk of a heart attack, a stroke, or other complications, and enjoy a longer and happier life. Now, we want to hear from you. Did you have some of these signs before? Was it actually heart disease? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.